I am Liz Powell. I am the founder and head of G2G Consulting, which stands for Government to Growth. I have spent 25 years now, I think that's right, in advocacy and lobbying. I used to work on Capitol Hill. I was a legislative director for a couple different members. I'm an attorney and I've got a master's in public health. And I am super passionate about connecting people to government to make a difference. We've been really active on women's health the past several years. Our leadership team, we've all been working together to work with the White House and on the initiative on women's health research, to work with Democrats and Republicans in the House and Senate on appropriations language. We have been working for many, many years, many different administrations, and we are super excited to see how far we have come and to make sure that we keep soaring. And we think there's lots of opportunities to do that. So without further ado, we're going to go through some slides, and then we're going to open it up for questions and discussion with all of you. So next slide, please. This is what we're going to cover today, give you some more background on Women's Health Advocates, our leadership team, what our focus is, our actions. We've already been active, and what we need from you, all of you today, you wonderful Women's Health Advocates. And then we're going to talk about the steering committee in particular. So that is the plan for today. Next slide, please. So, number one, we are a bipartisan health advocacy organization for every woman. So we are trying to cover the holistic needs of women's health. So that means those conditions or diseases that solely, disproportionately, or differently impact the health of women over the lifespan, head to toe. So it's those comprehensive women's health issues. We are bipartisan. We have Democrats and Republicans in our group. We have already been meeting. We were just on the Hill last week. We're meeting and talking to Democrats and Republicans, key committee leaders regularly. And so that's super important to this effort. Our mission is to make sure that we educate and advocate for women's health. That is super simple mission. There's a lot of new members, over 70 new members of Congress. There's returning members that are still, not familiar with what the definition of women's health really is. So we are working to do that education process and to find that common ground where we can work with different members of Congress and work with the new administration. We are distinctive. What is our distinction? We are the only lobbying organization. So there are many wonderful companies and organizations that are nonprofits out there doing great work in advancing women's health, and we see this as additive. We want to work with you. But we're the only one that is 100% lobbying. And what that means is, as a lobbying firm, we have the expertise. We're already bipartisan. We have the expertise. We're on Capitol Hill regularly. But it means that we can spend 100% of our time on lobbying, whereas a nonprofit organization can only spend 20% of its budget on any kind of advocacy work. And there's lots of reporting restrictions around that. And then a PAC, which I know a lot of you have been involved with, the Women's Health PAC, which I left after the election. That is for funding candidates. So that's a different entity as well. So just to clarify, I know it gets confusing on all these different entities, but that is why we are different. We are solely focused on lobbying. And our effectiveness. So G2G is a firm, my firm. We've raised $545 million in government funding for our clients. Much of that is in the life sciences. We have changed legislation and regulations. We've secured CMS reimbursement rates. We've done all kinds of Capitol Hill days, even State House days, all kinds of things. So we deliver results, and I think that we will deliver results for this organization. So that's us. That's how we're different. Next slide, please. Our leadership team, and I would love to pass to Netta Hanafia for this one.
Thanks so much, Liz. Good morning, everyone. Good afternoon. Thank you for taking time to be with us today. Super excited to be here. And as Liz said, it's the power of we, and it's the power of us collectively coming together to advocate and to lobby for projects and programs and policies and priorities that impact us directly and that we all care about. As you can see, we have a very diverse leadership team. Yes, we're all XX and we're female, but we have diversity in expertise, in where we come from, in age, in our lived experiences, and that's the power of collaboration and the drive towards positive change. So I'm Neda Hanafi. I also come from over 20 20 plus years of experience in the regulatory world within the medical device space. I work with companies to help them develop products that are inclusive and actually meet the unique needs of end users. So really love working with founders of color, female founders, and those working in hard to navigate spaces, especially women's health or areas that disproportionately impact women. So I'm excited to be here. I'm excited to share this space and time with everyone on this call. And I'm actually going to invite my co-leads to come on. I see Beth in front of me smiling or being very serious right now to intro herself. Just 20 to 30 seconds, guys. And I've asked for you all to do the same in the chat. We'd love to know where you're calling from. What's your why? Why are you here? And get to know each other through that avenue. Hopefully we'll have smaller discussion groups in the future when you join us and be part of this team so we can truly get to know you, because it's the person behind the work that matters. So thank you. Beth, I'm going to send it over to you.
I think I'm supposed to go last, Netta.
Oh, are you? Well, okay then. Jocelyn, you're smiling.
Those were Liz's.
So I'm going to go to you, Jocelyn.
Hi, everyone. My name is Jocelyn Fitzgerald. I am a urogynecologist in Pittsburgh at the University of Pittsburgh. As you can see, I'm in the middle of my office day today. And very happy to be with you all. It's been so inspiring and awesome to be a part of this group, and thank you to Liz. So the things, my why and what I'm really working very hard on is to bring to light the incredible disparities in reimbursement for women's health, particularly obstetrics and gynecology, and the surgeries we perform and the services that we provide to hospitals. This issue really is exploding. We have so many groups, news outlets, advocacy groups, powerful research engines like wanting to really work on this now. We're working with CMS actively at the moment. Recently had a paper published within the last couple of weeks where we showed that the disparities between what is reimbursed for female anatomy versus male anatomy in the reproductive health sphere is worse than ever. The disparity is enormous between gynecologic procedures and urologic procedures. A really interesting piece was actually just published. I'll put in the chat right now. I had it copied and ready to go. I'll put it in a second. I will send, yes, the paper around. And also a really awesome piece was in the New England Journal of Medicine that was published today, talking about the relative value of life-saving care for babies in the delivery room relative to like what's reimbursed. And the example they give was electrolysis, like 30 minutes of electrolysis reimburses 200 times what it costs to resuscitate a baby in a delivery room. So women's health is really being phased out of hospitals that can't support the losses for service provision. All that is to say, that's why I'm involved, and that's what we're working towards, because we don't want to see the literal extinction of women's health services in hospitals across the US. It's already happening. It's happening in DC's backyard. It's happening in every city and every rural area in America. So it's really a public health crisis, and that is why I'm here. So I'll be here to share our research and everything we're doing. And yeah, it's exploding. It's happening really fast at the moment. So it's a good problem to have.
Thank you, Dr. Fitzgerald. Evidence and data changes people's minds. So thank you for sharing that example. Leslie, you're in front of me. So if you'd like to come up, and if the leadership team would like to just come on camera, and then I can call on you as we go across.
Hi, I've had over 25 years in corporate innovation and have spent the last 10 focused really on women's health issues, and came to this group formally via the PAC and the work I was doing with Liz there, and feel that if we can help women access not just adequate but quality healthcare, we can really impact all aspects of their lives. And that is what we need to be doing, especially at this time in this country.
Thank you, Leslie. I'm going to go across Dr. Bale. I know you're in your car, your favorite Meeting spot.
I am. Thank you very much. Yes, I am. I'm on call for 2 hospitals. I think that's always my intro, but I'm Dr. Bio Curry Winchell, known as Dr. Bio. I'm a practicing family medicine physician and health advocate. And my why is really helping people understand their health and also knowing how to navigate it and how to advocate for themselves each time they seek care. And I have had a lived experience in this space, so that has also propelled me to help as many people as possible. And I'm the founder of Beyond Clinical Walls, and I'm just grateful to be amongst these amazing, powerful shaker movers as far as women. And thank you, Liz, for just having me.
Wonderful. Thank you, Dr. Bayo. Dion, I'm going to move down because we're moving down.
Good afternoon, everyone. I'm Dion Boyd, based here in the Washington, D.C. area as well. My background is in coaching and consulting and executive leadership. But the same women that we're talking about their health, they show up in organizations, and we bring these challenges. So my why is centered in women's health is central to our families, to our communities, and to our nation, very simply put, and to our world. So I come with that lens, and am glad to be with these brilliant minds and all of you on the call to just continue to advocate for women in all their ways. So thanks.
Thank you, Dion. And Dr. Linda, going to turn it to you.
Okay. Well, thank you. Let me add my thanks for this group. Liz, thank you for your work, and to the rest of the leadership. I'm Linda Goler-Blount, president of the Black Women's Health Imperative, chair of the Rare Disease Diversity Coalition, and I'm also an epidemiologist. And my why is because systems change is the only way to improve Black women's health, and policy is the only way to get to systems change. And we know, for example, when we look at breast cancer screening, we helped get the PALS Act passed to keep screening at 40. The data that they use for that, their recommendations to raise the age to 50 were based on studies in Sweden and Canada. There's a huge difference in breast cancer experience between Black women and white women. So it's our opportunity to bring data to policy to make sure that policy makes sense and it serves us all. And to, just add my voice to the others to make sure that women and women of color in particular get the standard of care and are included in the evidence that leads to that standard of care. So I'm so excited about this work and looking forward to the conversation. Thank you.
Wonderful. Thank you, Linda. And Vanessa, turning it over to you.
Hi, everyone. I mean, I am just so excited that there are so many people here. It is a thrill to be a part of this group. And I love hearing everyone's whys every time because it makes me want to show up even on the days that I'm tired and exhausted. I am 49 years old, and I like to say that because I'm coming up on 20 years since my very first cancer diagnosis, which really changed the entire trajectory of my life. I thought I was going to be a music teacher and an opera singer, and the world had a different plan for my life, and I fought it for a really long time. But what I realized is that my calling was really rooted in my pain and my suffering and in my health conditions, which I've experienced many of. And that has led me to this place. So I do a lot of work at the intersection of survivorship and mental health, a lot of clinician-facing education. I'm super excited to be in DC now and working more at the policy level and learning so much from Liz and her team. I also am the founder of a nonprofit, Living After Crisis. And one of the things I love about this group is that there really is a diversity of thought and experience here, which I hope shows everyone that you are welcome here, that you belong here. And I am also helping to lead up the Breast Cancer Early Detection Coalition. So we will put the link in the chat, and we hope that you will be a part of that as well.
Awesome. Thank you, Vanessa. And folks already sharing how grateful they are that you're being vulnerable and open. And that is, it's a safe space. Again, we have to show up as our authentic self, because that's what matters and who matters behind the work we do. We're also lucky enough to be joined by Liz's amazing team from G2G. And I'd love to just call on them to introduce themselves, because they're the folks really a lot of times doing the work behind the screen. And we really appreciate you and our thought leaders and experts within their space. So Katie, I'll turn it to you, and then Chris and Madeline.
Thanks, Netta. Hi there, everyone. I'm Katie Collins. I'm a vice president at G2G and have had the privilege for the past 5 years or so working with Liz and these incredible advocates on this call right now on women's health. My background is in health policy, specifically oncology. I was part of the original cancer moonshot back in the Obama White House, and then part of then Vice President Biden's health team, and was the program director at the Biden Cancer Initiative before doing some work at NIH. So I'm really pleased to be here, and thank you for including me. And I'll turn it over to Chris Cooper.
Hi, everyone. My name is Chris Cooper, and I'm the Government Affairs Director in G2G's Washington, D.C. office. Before joining the firm, I spent more than a decade working for 2 Republican members of the U.S. House of Representatives. And so my background is in policy formulation and budget formulation, and I look forward to working with everyone on the call. And I'll turn it over to Madeline.
Hi, everyone. I'm Madeline Stickley. I'm a Government Affairs Associate and Women's Health Coordinator here at G2G. Before I was at G2G, I was a part of Rosa DeLauro's office in Congress. She's the current ranking member of Appropriations in the House. I'm excited to work with you all and learn from you all.
Awesome. Thank you so much. And I know I'm going to now hand it off to Dr. Garner to take us home. And Mitzi Krokoff, as well as Eleanor Rios, are not on the call today, but they are a vital part of our leadership group. So I'm sure they'll join us next time. Go ahead, Beth.
Thank you so much, my dear. So I'm Beth Garner. I'm a women's health physician by training, trained back in Boston as an OBGYN and a GYN oncologist. After several years of practice, which I loved, I left clinical medicine because I felt I could have a bigger impact on the health of women. So that is my why, is impacting the health of women. I've now been working in pharma for about 18 years. Been really, really fortunate to have spent all of those years in the women's health space, worked in large, small companies, and currently my role is as CEO of a startup therapeutics company spun out of Mass General. So really excited. So I'm going to talk about what we're going to be focusing on as advocates. So you can go, I think, to the next slide if you haven't already. Yes, you can go to the next slide. Awesome. So as you all know, right, what we're doing as women's advocates could not be more important now, right? As we can be sure the coming years will be challenging in many ways. I think the good news leading up to 2025 for sure is there's been incredible growth, right, in awareness about women's health. Women's health has been better defined, in particular that women's health is far broader than just reproduction. There's increasing interest in investment in some areas, right, femtech, digital health. There's been huge growth in investment. All of this is great. Obviously, we all know we're here, right? So there's obviously so much more to accomplish, especially as it relates to other areas, right? So what we must do as women's health advocates is continue to insist on more attention and investment in the health of women. So with that in mind, you can see a number of focus areas that we've defined as key, right? Key things that we need to address to impact the health of women. And as you'll see, kind of looking, and I'm not going to go through every one, obviously, but these are the areas on which we aim to educate and influence policy as we go forward. And you can see we're focusing not only on medical conditions, right, but also on issues, right, such as increasing the representation of women, in particular women of color in clinical trials. As it does relate to conditions, we're also going beyond conditions that only affect women. And I'm sure many of you, probably most of you who are on this call today, are quite aware of that already, right? We've been talking about this for several years now. But for some of you who may be new to this area, we're focusing, like I said, not just on conditions that only affect women, things like menopause, but we're also going to be focusing on conditions that differently and or disproportionately affect females compared to males, right? Such as autoimmune health that you see there on the slide, heart health, and others like that. You already heard from Jocelyn Fitzgerald. One of the key things that I also just feel is so important as a surgeon, even 20, 30 years ago, this was an issue. So to see it now being addressed is so exciting for me, this whole CMS reimbursement discrimination. Again, for those of you who are joining us for the first time, yes, and as Jocelyn already said, there are sex-based differences even in hospital payments, right, for comparable procedures performed on men versus women. We're going to fix that for sure. And no doubt, with Jocelyn Fitzgerald at the helm, who is amazing, and on this call, as you know, I'm certain that we will. So that's kind of an overview of how we're approaching what we're going to be focusing on from an advocacy standpoint. So with that, I'll hand it over to Liz.
Great. Next slide, please. First action. We are taking action right away. So I think many of you know we sent a letter, or we've drafted, sorry, we have not sent it. We've drafted a letter to President Trump, and we are doing the same letter to Congress. So we're going to send it to both Congress and President Trump. And I'm posting it right here in case you haven't seen it yet. So we want as many people to sign on as possible. Many of you were involved in the effort that we did last year to get letters into the White House and to Congress. And we had over 1,000 people sign the letter that we sent into Congress. That was hugely impactful. And if you're questioning if advocacy works, it does, because one of the items that we asked for was increased funding for the Office of Research on Women's Health, which did get an increased funding level in both the Republican House version of the bill and the Senate Democrat version of the bill at the end of last year. So they still have to finish up appropriations for the current fiscal year. So we'll see what happens. They have until March 14th. But that is an example of when we come together and we send these communications, we are heard. So please know that your signing on this letter makes a big difference. You don't have to put your organization. You could just say consultant if you want. But if you can put your organization, that obviously helps us a lot too. So that's our first action. As Jocelyn talked about, we actually, this working group on the CMS reimbursement, we've been working for quite a while now on meeting with folks in the administration and the career experts at CMS for a while on this reimbursement discrimination issue. And we are doing an official submission on February 10th and welcome others doing submissions to support that. But Jocelyn and this amazing team, they've really done a fantastic job outlining all the discrepancies in payment. And we're trying to make it just very factual around discrepancy in payment. So, because we know now is a time we have to be very careful with our words. But all the data is there. And when we talked with the career professionals at CMS, they literally kept saying, this is irrefutable. This data is irrefutable. So they asked us to do this official submission. So we're doing that. And then we're also going to Capitol Hill. So another activity of first action is planning this Capitol Hill Day on April 29th on the CMS reimbursement discrimination issue. And we've got a lineup of amazing speakers. I've been talking with both Republicans and Democrats. We're going to get both to members of Congress at both sides of the aisle to come and speak. So this is definitely a bipartisan issue. And I think it really is something that resonates with physicians in Congress. So that is something that we are going after as well. So that's another action. But for the letter, please sign on to the letter. It's really important we get as many people as possible. And please share it with your network. It's not too late to post on LinkedIn, Instagram. We will get an Instagram account. We don't have that today, but we are going to get that as well. And we'll be super active on LinkedIn and Instagram. So please circulate as much as you can and sign on. Next slide, please. I think I started to talk about next actions. So definitely the letter. So we aim to send it in at the end of next week. So we really have just a few more days to get people on that letter. So please do a hard push and let us know by the end of next week, because that's when I would like to send it. The FY26 appropriations process. So not to get into the weeds, but just a quick overview. So they need to finish FY25, which we're halfway through. The fiscal year starts October 1 every year. So they need to finish that up with an omnibus package. They're also starting to work on budget reconciliation, which is key to them setting funding levels and including the tax cuts that Trump implemented in his first administration. Those are going to expire. So they need to use the reconciliation process, because you can move that legislation through with a simple majority. So that is the big focus right now. So as they're working on that and teeing up for this FY26 process, we know that there's ways that we can be influential and shape that process and insert language. That's something that G2G is an expert in. We've been doing this for many years. So that is definitely our strategy. Now there are other pieces of legislation out there, and we will definitely be tracking those and getting involved where it makes sense. But just so you know, every year it's those 12 appropriation bills that usually comes together as an omnibus that must pass, and then the National Defense Authorization Act. So it's those 13 bills every year pass. Anything else that you hear about, it's a reauthorization bill or some other proposal, it takes 5 years or longer. So that's why it's a moving train. We want to jump on it and shape it. So I can say more of that at another time, but that's the gist of our strategy. So the third item is this April 29th Capitol Hill briefing on CMS reimbursement discrimination. We'll also be doing some meetings with key committee folks. So that's a really great event coming up, thanks to Jocelyn's leadership. And we have, when you sign up to join to get on our email list, you can select issues that you care about, that you want to be involved in, and CMS reimbursement is one of those issues. So be sure to click that if that's of interest. We want to get you involved in that. But whatever you're interested in, we are trying to make sure that we're super organized in getting these groups going around those issues. May 21st is our Capitol Hill Day for the broader women's health advocates, and it's really for the steering committee. So we are not aiming to have hundreds or thousands of folks. It's a more focused, really senior level type of event where we'll meet with members of Congress. We'll do this congressional briefing on Capitol Hill, and then we'll probably close the day with a dinner. And so we'll have more details on that, and we'll set up a separate call with just the steering committee to map that out. But we're starting to pull together speakers. We've been talking with some famous folks around getting involved in this as well. So I think that helps too. So more to come on that. And then throughout the rest of the year. So we need to get through this appropriations beginning of the year process, and that's why we're focused on that. But then by June, July, we will shift to doing events out in across the country. And what we want to do is always educate, bring together amazing individuals with very impressive insights, and then close out with advocacy training so that everyone is empowered to become an advocate. So we've got amazing leaders in San Francisco, just met with them at JP Morgan, super energized folks. And then we've got great folks in Boston and New York. So we will be doing these events throughout the rest of the year. And there'll be more to come, more events. And then we'd love to do towards the end of the year in October, some big Capitol Hill Day where all of us are on Capitol Hill wearing our shirts, our tote bags, our scarves, so we're all in unity, thousands of us making clear that women's health is a priority. So we've got big plans, but you are key to making those plans a reality. So next slide, please. This is what we need from you. So sign up for our email list. We've been posting. Our website is womenshealthadvocates.org. And so you can sign up there to get on our email list. That's really critical. Follow us on LinkedIn. We also put that in the chat box. Please follow us, post, repost, etc. And when you post, tag us. We want to make sure that we are really spreading the word on the importance of addressing women's health. Dial into our monthly calls. We will have monthly calls the first Wednesday of every month at 12 o'clock, open to all. Today, we're doing the full hour open to all, but starting next month, it will be the first half hour open to all and the second half hour just for steering committee. participating in our advocacy campaigns. So we will be doing letters to the Hill in addition to this initial letter where you do targeted communications to your member of Congress. We'll send you templates. We'll show you exactly how to do it. But those are the types of things that we'll need when we're doing hard pushes on specific legislative asks. And you as a constituent have huge power with your member of Congress. So we want to make sure that you know how to use that and can be really effective. And, you know, I think Linda's really good at saying this. Vanessa's good at saying this. It is that combination of your personal story and statistics that is super impactful. So your voice, your story really convinces staff. And I can tell you as a former Capitol staffer, I will never forget the meetings I had with those patient advocates. I can literally still picture their face. They're sitting on the couch across from me. Absolutely, thumbs up, Vanessa. It works. And so just really want to emphasize we're patient-centric and we care because we know every single one of us has a story. And people will care on Capitol Hill. So super, super important. And then join our steering committee. This is a really important leadership role in this organization. As a member of the steering committee, you can lead and speak on our online events. We're trying to do an online series that aligns with those issue areas that you saw earlier that Beth talked about. Coming to DC, meeting with members of Congress directly, doing some of these private dinners with members. Now, again, because we're not a nonprofit, we can organize fundraisers directly. And so we will be organizing fundraisers. I've already talked to the chair of a key appropriations subcommittee that will be determining all the health funding levels about doing a private dinner. So would love to have steering committee members be part of that and really make sure that we're talking at the highest levels to implement change. Next slide, please. So I'd love to pass to Linda to talk about our steering committee and how important this is.
Thank you, Liz. I think you all have heard just how critical the work is. All of you are committed to improving women's health and eliminating the barriers that too many of us face. So I would say, you know, this is the imperative for this year and perhaps for the next 4 years. And so we want to invite you all to join the steering committee. And I think there's 4 really important areas, although there's many. As a women's health advocates steering committee member, you'll play a direct role in shaping federal policy that advances women's health. Your expertise, but as Liz talked about, your stories are so important for lobbying and advocacy to influence legislation and funding decisions and the regulatory processes that impact millions of women across the country. The strategic network and collaboration. The committee members speak at high-level policy events in the women's health space, research, life sciences space, and the committee provides a unique platform to share intelligence and experience to amplify the critical importance of women's health. Also, there's the insider access to advocacy and planning that Liz talked about. Members gain exclusive opportunities to shape advocacy and policy, to contribute to strategic decisions and actions, including working on influencing key legislative targets, crafting policy briefs, developing messaging that resonates across the aisle with decision makers. And your expertise and your stories, again, help drive the most effective and coordinated policy agenda in women's health. And, you know, finally, I'll just end with, you know, the exclusive access and influence on Capitol Hill. All of you bring your own contacts, your own experience and history. So with the committee, we have deep credibility with all of this expertise on the Hill, with established relationships across, you know, congressional committees, agencies, policymakers at the corporate level. Also, this is critically important that we have to address corporate leaders, those people, as I like to say, whose hands are on the levers of power. And as Liz mentioned, we'll have a separate call for steering committee members, for example, to plan the upcoming event on May 21st, the Capitol Hill Day event, but also to plan congressional briefings, direct lobbying meetings. Liz talked about dinners. But the important thing is to ensure that our voice and women's health are at the table and considered and taken seriously, and most importantly, acted on. So we invite you to join us. Liz gave the website, womenshealthadvocates.org. Pick the level that works for you for the steering committee. We'll take any and all at the visionary level, but find what works for you. Get on our mailing list, and just know that we need all of us. It's going to take all of us to do this work, to continue the drumbeat, to continue bringing evidence and science and data and stories to policy and common sense. Thank you.
Yes, 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 yes. All right, last slide. I think we're just at Q&A, so we can take down the slides. Super important. I can't read all that's been put in this chat box, but did catch a couple things and want to make sure it's super clear. We are an evidence-backed organization, and so we support vaccines. We know that vaccines work, and we will just find other ways to work with soon-to-be Secretary Kennedy, for example. You know, most of us are pro-choice, so we will just find other ways to work with. We actually had a great meeting with the leader of the pro-life caucus in the Senate. And we're like, well, let's work on women's health research. They're like, great. So we'll find common ground to work with people. And we will always lead with evidence and facts. That is super important. And as you can see, this leadership team, we've got doctors, lawyers, MBAs, like people who are very established and credible. That's super important. And that's really important to our steering committee. We need that credibility and we need your expertise to communicate in a way that resonates and finds that common ground. And then
Liz,
I think those are all the things I wanted to say. So yeah, so go ahead. Yeah.
yeah, Dr. Rios is on. Did she introduce herself and speak to the folks?
Oh, yes. Hey, Elena. Would you like to introduce yourself? We did that at the beginning.
Yeah, hi, Elena Rios, president of the National Hispanic Health Foundation. Sorry, it took me a little while to get into the system, I guess. I'm not sure what's going on with the Zoom that you have, the registration. Keeps going back and forth.
Yeah.
But the Zoom
Elena,
link today, I think, was okay.
I had the same problem, and I'm the host of this thing, and I couldn't get in the
yeah.
first few minutes. We apparently had an oversubscribing past the number than we thought, and so we had to switch it. So I apologize for that.
No, that's okay. But anyway, glad to be
Okay,
here.
next time.
Sorry I haven't been able to make meetings, but I want to be a part of this.
Absolutely.
And thank you for everything you're doing with reaching out to Congress. I think we all need to do that.
Yes. All right, so we're open for questions. You can go to the Q&A box, and my teammates here can help me. How is this group being funded? So the steering committee is really key because it costs money to be effective. And not only do we want to plaster Capitol Hill and like see every single member of Congress, really starting with those freshmen and the women members and then these key committees of jurisdiction, but we want to see all of them. We want to go to events with the Speaker of the House. We want to go to events with the Majority Leader of the Senate. We want to make sure that we are in front of all these people, and we want to do marketing campaigns and do ads in these like the Hill and the Roll Call and the Political Pro and the news sources that Capitol Hill relies on, that everyone in Washington relies on. We want to be there front and center. So to do all these things, plus most of all, as I said, we're patient-centric organization. We want to bring patients to Washington. And so we want to be able to sponsor those patients being able to come to DC to share their stories. So that is what the funds are used for. So that is how we're being funded. How do we join the steering committee? So I think we posted that. I'll post it again right here. So please join our steering committee. And hey, I'd love to take the first person to join our steering committee. I'd love to take you to coffee or lunch. So sign up now. The first person I would love to take out when you come to town for our briefing, or if I'm in your neck of the woods, let's get together. Super excited to have folks on this steering committee. Is this group exclusively focused on federal legislation or also on state and local? That's a great question, and I would love to go there. I think to start out, we're going to start out federal because we want to be focused and effective. But over time, I definitely can see us doing state. I'm registered to lobbyist in states. I've done a lot of lobbying work actually in Maryland and Ohio in particular, also lobbied in Pennsylvania and Kentucky. And my team has that background too. So we definitely can do state work. And then this leadership team who you see before you now, a lot of folks have also done a lot of state lobbying. So we can do state stuff, and it's very important that we get involved at that state level. So that's a yes, but it's not quite now. So it will get there though, 100%.
I just wanted to mention for the nonprofits and the people that were asking if they can't join the steering committee at the financial level, are there opportunities for them to participate? Yes, 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 yes. The answer is yes. We need everyone, and there will be plenty of opportunities for everyone to participate in a variety of different ways. We want to create a movement that is not just a few people, but is many people. And then there was another question about donating and the for-profit versus 501c3. Certainly, we have relationships with many nonprofits. So if you want to discuss anything around kind of supporting this initiative, but also want to support a nonprofit in because that's the way your organization works, please definitely reach out to us. We want to talk to everyone because we want everyone to be involved.
Thank you, Vanessa. We are going to have regional leaders who are planning events. We're starting out with San Francisco, Boston, New York. So we do need regional leaders for that. And then just being in within these subgroups that we have, everything from menopause to cancer, people can be leaders there. So there are definitely lots of ways to be leaders without being on the steering committee, just to be clear on that. And also, apparently, I put the wrong link to join the steering committee. So my bad. So I just put the right one in there. Okay, are we doing anything on RFK nomination? I think at this point with Cassidy supporting, it's going to happen. It's going to go through. I thought Cassidy might oppose him and he might not make it. But now at this point, it looks like he will. And as I said, we support vaccines. All the data is out on vaccines. There's no question. And he is currently suing in California against HPV vaccine, even though HPV vaccine has been proven to prevent up to 90% of all cervical cancers. So it is a bit insane. But we're just going to have to find other things that we can do with him. I will say this, Dorothy Fink, who is running HHS now, is a friend. We've worked with her over the years. We worked with her in the previous Trump administration, we worked with her through Biden's administration. So we will keep working with her. And I think that we will find things that we can do with him. So that's the answer to that one. Is there a cap on the number of people who can be on the steering committee meetings? Not yet. No, there's no cap. I can't imagine that we would have 1,000 people on the steering committee. So I think we're good there. How can one individually get involved and support the effort at a grassroots level within their own communities? Yes, we're gonna do advocacy training. Sally is one of our leaders of the Breast Cancer Early Detection Coalition, and she's a master of all things social media. So she's actually going to do a training. We're going to plan a training on that, and then we'll do trainings on how to be an effective advocate in your community. So absolutely, we want you to be part of that. And if you have that expertise, great. You could maybe be a speaker and how to teach others how to do it. So. That would be great. We're definitely looking to partner with organizations. We definitely would like to do that. Someone submitted on the website to join the steering committee. All right, whoever came in, I'm going to get an email for the first person. And so you're my date. We're going to go out. We're going to talk about all things women's health. That's going to be awesome. Okay. Passion for menopause. Yes, we're companies, nonprofits, all folks, educational institutions, or all folks are involved in this effort. Any breast cancer initiative events. So we are planning to do a Capitol Hill briefing in June. We just we've met with the co-chairs. So Klobuchar and Marshall are the two senators, and DeLauro and Fitzpatrick are their House representatives. They are working to introduce the bill again this month. And then we want to do an online lobbying campaign to get co-sponsors and then do a big event in June. And we're trying to be strategic around that appropriations process. It's going to suck up all the air in the room. So we wanted to wait to do our official briefing in June, since that measure is outside that appropriations process. And then we're also thinking of we are going to do an effort to get a study by GAO on the cost differential of diagnosing breast cancer in stage 1 to 2 versus 3 to 4. It is way more expensive on Medicare, which will be very compelling data. So we're working on getting that and presenting that to get more people to be co-sponsors. So definitely lots of initiatives with breast cancer, and you can go to our website for that, which is bcearlydetectioncoalition.org. And Vanessa's, if you have anything to add, Vanessa's awesome at managing that.
Yeah, just reach out if you have any questions. We are looking forward to having as much support in that area as we can.
Great. All right, any other questions?
Liz, can I just put in a plug also for any of those of you who are in the South? We need your voice in the South. As a resident of Georgia, we have our own special challenges when it comes to women's health. So just let us know if you're interested and you're in the South.
Yeah, I think that that's a really good point. Thank you so much for mentioning that, Linda. One of the things is having people in all areas across the United States that can share their lived experiences with, with the lawmakers that are in their constituents. So if you are from a specific state and you really want to get involved, definitely reach out, fill out that form. On that form, you will be able to fill out your state, your zip code. So we'll know where you're located. And so we'll know how to fit you into conversations, because not every conversation has to happen in person here in DC. Many conversations can happen via Zoom. And this is where the collective voice of everyone who is across this country really, really makes a difference.
Yeah.
There's some really good comments and questions as relates to even engagement at the university or college level and engaging students. And that is really critical. It starts early on. So I think, definitely there's a way for folks to reach out to us, right, Liz, and provide some input or suggestions. And that's the beauty of the steering committee. You get to help steer or guide where we focus our efforts. And there may be tangential programs that could come out of this. So we're not limited. And this is like this platform to connect these brilliant minds and ideas and create programming that's meaningful to you. Because again, we keep talking lived experience. You know your space, you know your disease, you know yourself, you know your needs better than anyone else. And how can we make sure that voice is incorporated in the efforts we're taking? Great question about how products are designed for rural settings or different patients from different backgrounds, SES. And that is a really critical one when it comes to FDA CMS. I'm sure you saw that anything related to DI has been removed off websites. The biggest one was the DAP, that's the Diversity Action Plan from FDA's perspective. That impacted all products they regulated. And that's been taken down. The FR notice, Federal Register notice, is still up. But the walk there is do good science. Regardless of if a policy is not saying it, people are committed to this. Companies should be committed to this. Many big companies are committed to this. And the onus is on us to do good science and develop products that are actually going to meet those unique needs of patients who really need them. So we don't want innovations to exasperate inequities. We want them to address those. And I think it's great that people are thinking about this. So it's live. MedTech Color, our nonprofit focused on diversifying the medtech industry, still providing programming related to how to include diverse and representative patients in clinical studies, how to include them in your development of products throughout the total product life cycle. So again, there's so many areas that folks know this is front and center and important, even though this administration hopefully doesn't last long. It's kind of giving us this butterfly effect. So I think these are all parts of the areas that we will be focusing on and want your voice and input to help guide how we approach those discussions and advocate for better products for end users.
We're getting a question about a donor advised fund for steering committee. You can use whatever funding source you'd like to join it, but to be clear, it's not a nonprofit, so there's no tax write-off for it. So hopefully that helps answer that question. Any other questions? Final thoughts from our amazing leaders?
I just wanted to offer, just to be obvious, if you haven't had a chance to put your question in the question tab option. I saw some other great questions. I think, Netta, you got to many of them. But if you haven't had a chance, just put it in the question option rather than just in the chat. There have been some great questions coming through.
Oh yeah, and yes, I have a question. Are we partnering with celebs? Well, we're everyone here on this call is a celebrity in their own right, but
Right.
the answer is yes. We are partnering. We are looking to partner with people that have a variety of influence in different areas, and you know, we won't say much more than that right now. But certainly, also if you have connections, both locally or even nationally, and you want to connect us with individuals, please reach out. Long term, we're going to be looking to do op-eds, and maybe that's in your local newspaper. Maybe that's in a national paper or periodical that you're a part of. So certainly reach out. We want your ideas and suggestions.
I see a question about different ways law firms or other organizations can be involved. And if you're not joining the steering committee, by all means, we will be hosting events everywhere, whether it's on Capitol Hill or in a local market. And we invite you to sponsor those events or participate with us in some way. We'd love to get you and your firm involved. So don't hesitate to reach out. There is a mail icon on the site. Click on that or send it to info@. I've dropped in the email to chat. And please just be specific about what you have in mind or what your ideas are, and we will try and respond to them.
And Liz, I just want to put in another plug for stories because right now they're so important. We're a CDC grantee, and they've held up all of the funding for the CDC programs. And so they owe us close to $500,000, and we have no idea if we're going to get that funding. So that means it impacts our grantees and their ability to deliver diabetes prevention work. And we don't want to capitalize on anybody's suffering, but people need to understand that when the funding stops, when research funding stops, when implementation stops, it does matter to the way people live, and it matters to their health. So as in your communities, in your experience, if people are sharing those stories, help us to amplify that, because I worry that these folks are somehow intellectually, emotionally separate from the impact of their decisions, and they don't actually see the causal relationship, but there is one, and people are going to be harmed.
I want to double tap on what Linda just mentioned. That part is so important. There's so much focus on DEI, different things that are now taboo, but the focus of the fact that health is still at the forefront. When these things are attacked, it will impact the health outcomes, the current state of affairs as far as people being able to seek care. And I think if we can tap into that piece where people are aware of, and I share my story, like the patients I see, I work at the county and I work at a private hospital as well. And so my patients are impacted, not being able to get the medications that they need, not even being able to be seen because of the Medicaid portal that went down. All of these things are important stories that we have to highlight. And whether it's personal or someone that you know, utilizing that. and putting it forward through different mediums. And if there's anything I can do, like with Linda, I'm already thinking of an idea. I'm happy to, tag team with you on Instagram. I'll see what I can do. I utilize different medias. Instagram, I write for Katie Kirk Media Group. There's an op-ed that I put in the link that highlights what Linda mentioned, that this does impact health. And I talked about what the new administration changes could do to impact a loved one and so forth. So let me know how I can help, but I just wanted to elevate Linda's message because it's so important for people to realize this is something that will impact them even tomorrow.
Yeah, 100%. And it's important to share those stories with your members of Congress because there's about 20 of them who barely won re-election. There's a bunch of them, well, a small bunch, but who they may have won by a few hundred votes, but their district actually voted for Biden. So they're very nervous. And so anyone that had a really close election, they're going to be particularly nervous about doing anything too extreme either way. So keep that in mind. And then in 2 years, there's an election for the Congress, right? So the House and Senate, they're up. So people are also very wary of that. So because there was an outcry, that's why they rescinded the OMB memo. So it does work. So just make sure you do tell your member of Congress if you have a grant and it's on hold right now, you need to explain in a calm, not throwing accusations or insults, right? Just a calm way, the facts that this means I have to now lay off 10 employees or, whatever that impact is. I think that's super important to share with your member. So I'm glad we're talking about that. All right, so I think we're past our time. So want to thank you all for dialing in. Please be sure to sign up, womenshealthadvocates.org. You can sign up to get on our email list and you can sign up to be on our steering committee. And we are super excited to team up with you and to make a difference. I know that we can if we work together. So thank you.